Depression is a common but serious mental health disorder where people experience low mood for a prolonged period of time, and it's really impacting their daily life. So they have difficulty functioning at home, in their families, for example, at work, or with their friends. Depression can affect people in multiple ways, I would say. It can affect people's way of thinking, so their thinking patterns can become very negative, for example, or it can even result in feelings of thoughts around hopelessness. It affects people's feelings, so it can trigger sadness, irritability, anxiety as well. And also it affects behavior. So what people do is that people stop doing the things that they normally did and that gave them pleasure or a sense of achievement or a sense of purpose. It can affect people in multiple facets of their life. The causes of depression are, it can be triggered by something, or it can be that there's no trigger identified. What we commonly see is that certain risk factors are present in people with depression that present with depressive symptoms. For example, physical illness. It can be very difficult to deal with a diagnosis, and that can trigger feelings of sadness. Another common symptom is serious life events, adverse life events. A divorce, for example, losing your job. Great transitional periods can also trigger periods of depression. Think about retirement or becoming a parent. These major life shifts can trigger depressions as well. But as said before, it can be that there's no trigger identified and that it is just unlucky that a person develops it. A depression can affect a person's life like individually, like their self-worth, but also in relation to their family. It can be that that there are more tensions in the family circles, for example, or people find it very difficult to activate themselves, to do stuff with their children. Then there is also the aspect of the work environment, where people experience this feeling of dread going into work, rather staying at home, finding it really difficult to find the motivation to get out and be active. Socially, it can also impact the fact that people might not go out with their friends anymore. They find excuses, not having to socialize. Quite often what we see with people in depression is that they do the things that are sort of counterproductive, right? They stop doing the things that gave meaning to their life, which only reinforces their feelings of missing out. So I would say then, of course, there's also a high comorbidity with other mental health disorders or even with physical illness as well. Depression can impact a person's life in all facets, I would say, interpersonally and also physically. The literature shows a huge correlation between depression and somatic health. There's an increased risk of heart disease and other mental health conditions, but what I'm more concerned about is the risk of suicide. Unfortunately, depression goes hand in hand with feeling of hopelessness. It depends, of course, on the severity of the depression, but with feelings of hopelessness comes the risk of suicidal thought and ideation. And I think mental health institutions, but also support networks need to be very vigilant. An integral part of the treatment of depression is psychotherapy, where we really look at the underlying causes of the depression. Alongside psychotherapy, we offer counseling and mindfulness, really to stay more in here and now and to strengthen the resources. So we look at it from both sides, the origin and also protective factors to strengthen the resources of a person. BioR, another pillar of the Kusnacht practice, focuses really on rejuvenation and biomolecular restoration. That's an integral part as well in the treatment of depression. They look at diet and exercise like the foundations to keep a person healthy. And then, of course, there's somatic health. treating underlying illness and making sure that somatically a person is healthy is also a protective factor when it comes to the treatment of depression. In the treatment of depression, the Kusnacht practice tries to focus on psychotherapy as much as possible. Of course, in severe cases or when absolutely necessary, then pharmacotherapy is possible. Depression is a serious but treatable mental health disorder, and it can be in remission. At the Kusnacht practice, the treatment protocol is targeting all aspects of mental health, working from a holistic point of view. We're not only looking at the root cause, but we also look at the strengths of the people. We're not only looking at their mental side, but also at their somatic health. And BioR, which looks at biomolecular restoration and rejuvenation, they really focus on keeping our body and mind healthy and young, and that can also be a hugely protective factor. So exercise, sleep, restoration, and diet, they are core foundations of keeping our mind and our body healthy. So what we do at the Kusnacht practice is we are strengthening all the resources of the person in making sure that the risk factors are reduced as much as possible. For the treatment of depression, we recommend a minimum stay of 6, ideally 8 weeks of treatment here at the Kusnacht practice, in which the first 2 weeks are really centered around assessment and getting to know you personally on a very deep level, and also to identify the goals that you want to work with. Then we are left with then we have at least a month to work more intensively as well and to help you reach your goals. Of course, there's the possibility and maybe as well the recommendation to stay a little bit longer in our care. And after discharge, we can also support you through our continuing care program. So we make an assessment, an in-depth treatment, but also prolonged support to help you reach your goals. It can be very hard for people to see their loved ones suffer from depression. And my first advice to you is to read about the condition. What is depression? What are the common symptoms? What are warning signs that you need to be aware of? It would be my first recommendation. The second recommendation would be to instigate maybe a conversation with your loved one about your concerns using concrete examples, and have an open and honest conversation about it and see if that person is already ready to accept help. Another tip was to really know what kind of helplines are out there in case you need support on the spot because you are very concerned about the well-being of your loved one. And my last advice to you would be to look after yourself. It can be incredibly demanding on yourself and on your own mental health to see someone suffer. And I always recommend people to follow the advice given in an airplane, to put on your own oxygen mask first before helping others. Another advice would be not to suffer in silence. If you're worried about a loved one, reach out to professionals. Depression is not only impacting the individual, it is impacting the whole system. And I would say is to be mindful of the behavior, make a distinction between the behavior and what is underlying that behavior. I can imagine that it must be incredibly frustrating if somebody is cancelling all the appointments or is retracting, is not opening up. I can imagine that it might trigger quite a lot of inner conflict in yourself as well, and might trigger some feelings of frustration or anger. And that is absolutely legitimate to feel that way. But in helping others, it would be really good to park that feeling and to reach out to ask them instead of putting it all inside. Open up the conversation in a non-judgmental way, in a caring way, so the person knows that it comes from a place of love and care. If a person is suffering from depression, it can take many shapes or forms. Some become very irritable. So when everything becomes snappy and only snappy responses you see, that might be a symptom of depression. When somebody is making up a lot of excuses not to attend social events or or sort of says, oh no, I'm fine, everything is fine, trying to avoid the topic of conversation, that might also be a red flag. Sudden changes in mood as well, you know. Sometimes depression can last for a long period of time. If all of a sudden it goes really well, according to the person, that can be a red flag as well. I think the answer is rather short. Everyone, no matter your age. We do know, however, that depression is a little bit more that women are overrepresented in the numbers. So according to research, women are more likely to develop a depression than men. But it might also be that men are underdiagnosed, of course. No, depression is a collective name, right? It's a collective mental health disorder. That there can be differences between it. Of course, it can vary in severity. You can have a mild depression and a severe depression. You can have a depressive episode, or you can have chronic depression. So there are differences, and not only in the intensity and in the duration, but also there's also, for example, seasonal affective disorder, where people, especially in autumn, become more down and experience more gloominess and finding it more difficult to activate. There's a lot of attention as well for postpartum depression, for example. That's something that can happen after or during pregnancy or after giving birth. It not only happens to women, but also fathers can be affected. These are interesting subcategories of depression, I would say, that we at the Kusnacht Practice as well specialize in.